Welcome back, everyone. So we are continuing our conversation about how you can support UP Home Health Hospice. We now have Martha, Smith-Process, and Leigh Harder joining us this morning. Thank you both for joining us. So what are there any happenings going on with UP Health Home Hospice that people should know about, that they can help support? I know we talked earlier about the other Living in the World Angels educational displays that people can go to, but is there anything else that people frequently ask you guys that they should know about UP Home Health Hospice?
Who wants to take this? Well, we have volunteer orientation, which I think Corey touched on a little bit. We offer that multiple times a year, so you'll see postings about that on our Facebook page. We'll get more awareness out there for that. I think that's the big thing, is the orientation for volunteers more than anything.
As far as frequently asked questions, probably how do I come into hospice? What qualifies somebody for hospice?
Yeah, what do you think is the most common misconception that you find people have about hospice care?
So commonly people think hospice means I'm dying now.
Right.
If I'm on hospice, it must mean that I'm actively dying and I have days to weeks to live. And that's just not true. Our focus in hospice is on living. Our focus is on keeping people comfortable and active in their community and their families as long as we can, whatever that means to them. We have folks who have been with us for many months, and we're able to keep supporting them and their families, keeping them comfortable out of the hospital so they can participate in their families and their community, again, in whatever way that means for them. So hospice doesn't mean that you're dying within days, but people certainly interpret that that way.
It means you're living with a life.
You certainly have a life-limiting illness.
Yes.
You know, that's just the honest truth. You have a life-limiting illness. If you were pursuing treatment for whatever reason that didn't work, or you're making choices about that, but it doesn't mean that you're dying immediately.
Right.
Absolutely not.
And illnesses, they don't discriminate against age. I think a lot of us, we might think about only elderly people receiving hospice care, but that's not necessarily always the case.
No, absolutely not. We have folks, we certainly have elderly folks. We have folks who are in their late 90s, 100 I think on occasion.
We've had some over 100, and we've had some that are, you know, as young as their 30s or 40s, you know, with a terminal illness like cancer. So it's any age, any gender, could be any diagnosis, but we see a lot of everything.
Now, I want to jump back to what you said just a couple of minutes ago, Martha. You mentioned that one of the commonly asked questions that you get is, how do we start this process? How do we start this care? So how do you start the care? When do you start the care?
So when you start the care is really a discussion between you and your physician, right? Hopefully you're having a conversation with your physician about treatment options and how those treatment options are going and the pros and cons of those treatment options. Sometimes there are treatment options, but they have such a negative impact on your well-being that you don't want to continue with those. And that's okay. So it begins with a conversation with your physician, either your specialist or your family, your primary physician, and then they make a call to hospice, determine that a hospice is appropriate, and they do a referral to hospice, and that's how that process begins.
And again, the amount of time that you're in hospice care, that varies. That's an individual scenario.
It really does vary.
Yeah, well, I mean, we will get some referrals, and we'll see patients as they are very near the end of their life. So it could be a matter of days. But then we also have patients that have a chronic illness where maybe they don't want to keep going to the hospital to seek out the same treatment over and over, and they want to just be comfortable at home and their symptoms managed there. So we may have some people for months, potentially up to years, because you never know necessarily what the course of a disease is going to be.
I mean, hospice care, dying, it can be a really sensitive topic for some families. How do you make sure that you're remaining sensitive to people's feelings, people's real issues that they're going through, but also providing this compassionate care that they need?
It's a real tightrope that we walk, the nurses and the social workers and the rest of the holistic team. It's a real tightrope between being really empathetic, understanding that families sometimes aren't ready to hear, or even if they hear it, aren't really ready to understand what it is that you're saying. So you're always balancing giving them enough information so that they're able to make a fully informed decision and understand what's going on, and backing off a little bit so that you don't overwhelm them, and they're not feeling hopeless or sometimes beat up on. And so, you know, as I said, it's kind of this tightrope that we walk, always keeping in mind that we're there to support people, right? So it's just a whole attitude every day for all of us of being really empathetic and understanding and caring. And we have a team that loves what they do and really does an extraordinary job of caring about the people that we're with.
Yeah, and I want to talk more about your team and what that might look like in a home setting. We do have to take another commercial break, but we'll pick up this conversation and wrap it up when we return.